Hi, my name is Dee, and this is my short course around Caesareans. I hope you enjoy it. So, what is included within this course? There's a couple of things that I really want to discuss. Firstly, back to basics. What is it? And the statistics within the UK. What to expect before, during, and after birth. Your options. You always have options. Birth partners, frequently asked questions, and brain. That's a mnemonic that we tend to use within finding out the best course of action for your care. We'll discuss it a little bit later. Now, as a doula, I'm not a healthcare professional and I won't give medical advice. And all sources of information are at the end of this course. If you have any questions impacting your care, please speak to your midwife consultant or seek a second opinion. And this is not about saying no at all. This is about giving you the all the information in order for you to make an informed decision about your care. So, what is a cesarean? So, a C section, or cesarean as it's called, is an operation in order to deliver your baby. It could be planned or unplanned. The doctor makes a cut through the lower part of your tummy and through the 7 layers of tissue through to your womb. The operation can take usually around 40 to 50 minutes, but can be longer depending upon the urgency. Now, most cesareans take place under a spinal or epidural anaesthetic within the UK, meaning that you will be awake, but the lower part of your body will be numbed, so you should feel tugging, but not any pain. On occasion, a general anaesthetic where you're put to sleep may be used, particularly if the baby needs to be delivered more quickly. Now, within the UK, so the national C section rate is around 42%. However, individual trusts will vary. Some will be higher, some will be lower. And you can see the breakdown of emergency and elective C sections on the right hand side of your screen. C sections are normally classified depending upon their urgency. So, starting with the least urgent, which is category 4, that's your elective C sections or your scheduled C sections, looking at the diary of the obstetrician and saying, at this particular gestation, this particular person can come in and have their C section. Moving on to category 3, there's no compromise to the mother or baby. However, early delivery is needed, usually within 24 hours. Moving on, category 2, where there is compromise to mother and baby, but it's not immediately life threatening, and delivery is wanted within 75 minutes. Now, the goal here is not for it to turn into a category 1 where there is immediate threat to mother and fetus, and cesarean is needed within 30 minutes. Now, there could be a lot of people within the room. You might be quite overwhelmed with it. Usually around 9 to 10, including you and your birth partner. All these people will have a role and work collaboratively for the safety of you and your baby. And just because they're in the room doesn't necessarily mean they're going to be called upon. And the number of people may increase if you've got any other needs. Say, for instance, you're having twins, there'll be double the amount of people in the room. So the people in the room will include a midwife, a consultant obstetrician, they're the people that will be doing the surgery. The anaesthetist and their assistant, they're the people that will be helping you with the pain relief. The pediatric team and resus team, they're the people that will be helping out the baby if there are any needs. The scrub and theatre nurses, they're the people that make sure that the obstetrician has everything that they need within theatre. And medical students and student midwives, they will be there with your permission, of course, if you decide to have a C section in order to facilitate their learning. Now, on your screen is a QR code. If you've got access to your phone, scan here and you will see a short video from Liverpool Women's Hospital which shows an obstetrics theatre. Also, if you're using your phone to view this, feel free to use the keywords down at the bottom, type it into YouTube and see whether or not you can view the video. Now, the designs will vary depending upon the trust, but you will be able to see what a theatre looks like if you're deciding to have a cesarean. So, why have you chosen to have a C section? Why would anybody choose to have a C section? Now, I'm going to stay away from medical jargon at this point because I don't think it's particularly necessary for all cases. Because it could be just be a medical reason to do with mother and baby. It could be mental, it could be emotional, it could be physical needs that all need to be taken into consideration. Alternatively, the parents have decided that that is the best choice for them. At the end of the day, it is a choice. It is not an easy way out. You have still given birth. Now, this is my favourite topic. Birth plan, birth preferences. You have so many options when it comes to C section. And I think it's a misconception that midwives don't read birth plans. Most do. They want to see how they can personalise their care for you when you're having a cesarean. So, birth plans may include your choice of birth partner, playing music during labor, having a camera or video playing during the operation, requesting for the screen to be lowered when the baby's born, and ensuring that there's silence when the baby's born so you can hear their first cry or the first voice that they hear will be yours. You've also got things like skin to skin, post delivery, optimal or delay core clamping, and things like lotus births, gentle sections, and maternal assisted sections. Those are terms that not necessarily every midwife will be clear with. However, there are papers about it at the end of this talk. Feel free to talk it through with them, and options will vary depending on where you live. So you may not get a date for your cesarean until about a week before the suggested gestation. And that may change due to demand. So when you leave hospital, you may not be able to do much or lift much. So prep, prep, prep. Really, really important here. Take some time to prep your food, the sleep area, painkillers, feeding stations, changing stations. It will make your transition back home a lot easier if you've prepped them beforehand. And also, read the pre op material. You will probably be asked to be nil by mouth or have a light meal prior to surgery. And you'll probably be asked to have some medication too. So give that a read. So, the day has finally arrived. You are meeting your baby today. And how you feel at this time may be completely alien to you, and that is absolutely fine. Depends whether or not this may be your first birth, or you may have had a cesarean before, or you've had a vaginal birth before. How you feel may feel a little bit alien to you, and that's fine. Let's discuss it from here. So, after getting your lovely compression socks on and getting into theatre, the anaesthetic will be injected into your spine and the effectiveness will be tested without before starting. They will insert a catheter and put up a screen or a sheet. Now, number two, an incision is made at the bottom of your stomach and the baby is born. You may be a little bit shocked about how small the scar is, but it's all done to aid the healing process. More about scar care a little bit later. Now, after the initial checks are done, the birth partner will usually be able to hold the baby and see the baby soon after delivery. And this is the beauty of a birth plan. You can speak about cutting the cord, skin to skin, and all those things that really matter to you. Number four, they will take some time stitching you back up and then you'll head back onto the recovery ward. And this may take some time, but you probably won't care because your baby will be here and you'll be soaking up all that lovely oxytocin. So after you've had your amazing baby, you'll be taken to recovery and then a ward for a minimum of 24 hours. Could be 48 hours, could be longer. And recovery may be slightly slower than a vaginal birth, so listen to your body and ask for help when needed. Upon discharge from the hospital, you could be given some iron tablets due to the amount of blood that you lost during surgery, as it's typically more than a vaginal birth. You'd also be given self administered blood thinning injections, which you're to take once a day for about 10 days. However, it could be up to 6 weeks if you have a higher risk of blood clots. More than anything else in this season, take it easy. As the anesthetic wears off, you may feel more capable, but please be cautious. We'll talk about scar care next. So, your scar will need to be kept dry. Hospitals will vary on the dressings and the stitchings used, but ask if you're unsure. And if it opens or shows any signs of infection, or you have any signs of infection, such as raised temperature, then seek medical advice ASAP. If it doesn't look right and doesn't feel right, make sure that it's all right. Now, the top photos here are of fresh scars, so usually within the first couple of days, as the dissolvable stitches have started to dissolve, and the bottom ones are a couple of years old. On the left side, showing on white skin, Caucasian skin, and on the right side, showing black skin. Numbness around the scar can last around 2 years. However, you can explore scar massage after about 6 weeks after it's completely healed in order to regain sensation in the area. Birth partners, cannot forget them. Now, you can pick anybody to be your birth partner. It doesn't need to be your partner in life. It could be your parent, it could be a parent, it could be an auntie, it could be your best friend. Um, and I do ask our birth partners that you have a conversation with them prior to going into hospital, asking if there's anything that they want or don't want within this period, as recovery can be slow, and you may be called upon in order to do some extra bits. But also consider your mental health too. You've just had a baby, you may have sleep deprivation, and all of those things need to be taken into consideration. So ask, what is the best thing that I can do for you through this season? Now, brain, the mnemonic I spoke about earlier. Now, we wouldn't necessarily include N within this, but anytime we're making decisions about your care, it's suggested that we know all the information, and brain can help with that. So, B, speaking about the benefits of the C section, the procedure. R, the risks. A, if there's any alternatives. And I, intuition. Does it feel right for me and my baby and my family? And as you can see on the screen, I've taken some time to consider the brain for having a C section. I'll leave that back on the screen for a little bit. Now, frequently asked questions. There's only two of these. So, can I breastfeed my baby? The truth is, you can feed your baby however you like. You can breastfeed, you can bottle feed, you can express feed, you can formula feed. But yes, you can breastfeed your baby after cesarean. They do suggest that you harvest some colostrum prior to giving birth by cesarean, as it can take some time for your milk to come through. However, yes, absolutely, you can breastfeed your baby. And also VBAC. VBAC stands for vaginal birth after cesarean. Now, can I have a vaginal birth after I've had a cesarean? In most cases, absolutely, yes, you can. And between 60 to 70% of women within the UK that decide to have a VBAC actually succeed with it. In conclusion, sometimes C sections are not part of Plan A nor Plan B, but they occur, leaving feelings of sadness, anger, and disappointment, which follows you into your postpartum journey. So, where you can, take some time to self reflect. And if you continue not to feel yourself, then please speak to somebody, whether or not it be your midwife, GP, health visitor, in fact, anyone that will listen. Get the help that you deserve and need. Also, consider speaking to your maternity unit about the birth reflection service. And that's it. There is a list of references on the screen in front of you. Take a look. If you've got any questions, then feel free to go onto Instagram. I am at DoulaCallD, and I'm more than happy to have a further conversation with you. Bye bye.